We are Makilala TV, the first Filipino-American TV talk show in the New York metro area. Get to know us as we talk to the community leaders, innovators, advocates, and emerging artists who affect Filipino-American life.
Hello, my name is Cristina Pastor. On behalf of my co-hosts Jen Fuhrer and Rachelle Ocampo, welcome to Makilala. It was hard to find guests for our episode today. The spouses of Filipino nurses are a unique demographic within our community. They're usually laid back, behind the scenes, providing quiet but steadfast support for their wives and husbands who are out there giving nurturing care to the American public. When COVID 19 struck in 2019 2020, the spouses were thrown into the emotional battlefield. There was this staggering anxiety that the nurses might bring home the virus and threaten the entire family. There was also the growing fear that they would fall ill or they would get attacked by hostile patients. Makilala is grateful that our guests today, Judith Sanchez and Joyce David, have accepted our invitation and agreed to talk about what a nurse's family is going through amid the threat of COVID 19. Joyce, an executive at Merck Laboratories, is married to Arman David, a post anesthesia care unit registered nurse at Christ Hospital in Jersey City. Judith Sanchez, a technical specialist at a medical device company called Diagnostica Stago, is married to Menchu de Luna Sanchez of Mount Sinai Hospital. Welcome to Makilala, Joyce and Judith. Thanks so much for accepting our invitation. Joyce, let me start with you. How are you?
Good, thanks, and thanks for having me.
Okay, good to have you back. Joyce, we're not over the hump yet in COVID, but we are at least able to breathe a little easier because people are getting vaccinated, hospitals have enough PPE. What do you remember from the early months when COVID was very new? Didn't know anything about it. People were dying left and right, and your husband is out there confronting it.
Well, we had just returned from the Philippines from a medical mission in mid-February. So I already knew what was happening with the rest of the world. And the funny thing is, we actually distributed about a balikbayan box full of N95 masks when we went to the Philippines because of the Taal volcano victims. So coming
Mhm.
back, we were already very careful. Unfortunately, we were really hoping that we kept some of the N95 for ourselves because at that
Yeah,
time, there was a shortage.
yeah.
Um, and really just trying to find ways to procure, PPE for my husband.
Mhm.
We got really creative. We made some homemade masks and
Oh,
homemade
really?
face
Is
shields.
that safe to use?
Well,
Those
it was better
homemade.
than nothing. I
Yeah.
I remember some of his coworkers using, garbage bags as their
Oh,
PPE
yeah.
because there's nothing else to protect them, right?
I saw
Um,
photos of that. Yeah.
yeah. So we've come a
And
long
and
way
you,
from that time. Yeah.
that's right. We really have come a long way. Judith, Menchu was undergoing recovery from a delicate kidney transplant around that time. What was it like going to the hospital and being in the company of patients who had a virus? How did you
Uh,
manage to keep her safe?
First of all, thank you very much for having me. And
Mhm.
well, like you said, it's really a good thing to remember when Menchu had her kidney transplant.
Mhm.
And what we did is we just simply follow the guidelines that was given to us by the member of the transplant team, and we
Oh.
follow it strictly in order to kind of prevent any other issues.
Mhm. And at the time, was it easy to get a room in a hospital? Like, I think the priority were COVID patients, right?
Uh, yeah, but Menchu actually has one one-time visit, once a month visit. It's not in the hospital, but in a clinic based
Oh, okay.
on the. We don't go on the hospital per se.
Oh,
They
okay,
have their
okay.
own clinic for transplant
For
patients.
transplant. Okay, okay. Good, good, good. So I'm
And then
sure Jen and
that is
Rochelle have questions of their own. Yeah.
Yeah. How did you feel? This is just in general of what's the atmosphere in the world right now of these healthcare workers who are not getting vaccinated. How do you feel about other nurses who refuse to get vaccinated alongside your spouses?
I'll go first if you don't mind. So
Mhm.
for me, being a research scientist, knowing what's been done to try to get us to this point where we have vaccines available, I find it very irresponsible of people, especially if you're in the healthcare field. You should
Mhm.
know and believe in science. So the
Mhm.
fact that you don't believe in science and are doubting the hard work of your colleagues, it's very frustrating. And like I said, um, I just wish that they would practice what they preach, right? When you
That's
go
right.
to the nurses or the doctors, they treat you, they advise you of what
Mhm.
care you should receive. But
Mhm.
here we are being advised that we need these vaccines to protect us. We're at 58% of the United States is vaccinated. Um,
Mhm. Only 58%?
only 58% currently.
Oh,
Yeah.
okay. Yeah,
So we've got a long way to go. And
that's
I can
right.
honestly tell you, my entire family's vaccinated. We practice
Mhm.
what we preach. My
Mhm.
youngest, who is 9 years old, was fully vaccinated with 2 doses the day before Thanksgiving.
Okay,
Is
great.
is it possible? I mean, I have family members who got COVID. They're all vaccinated, we got booster and all that stuff. But is it possible that some healthcare professionals like believe that since they already got COVID in the beginning and they don't really see why they have to be vaccinated?
They should already know that. The way that they're testing the antibodies that are in our bodies, they know that. They should
Mhm.
know that it decreases over time, and the level of antibodies that you have from getting COVID is much less than the antibodies that you would have once vaccinated. It's thousands of antibodies in difference.
Mhm.
But what
So
about those that say maybe we should just do tests every day? I mean, there are some people that said, you know what, we really are worried about being vaccinated. What's the most
Yeah,
important thing is
yeah.
every day you go to work, get me tested.
Mhm.
Maybe that's another way for them to help prevent the spread.
yeah, I mean, but you still risk yourself contracting it, right? You're getting
Yeah, yeah.
tested after the fact. We're talking about a preventative measure versus, a way of just checking yourself.
So Judith, do you believe that people or healthcare workers who are not vaccinated should be removed from their jobs? Judith?
This one is very very delicate way of doing stuff, but
Mhm.
I agree totally with Joyce.
Mhm.
First of all, everybody must be educated, and not only educated. I always say I've been a teacher one time in my life, and I continue to teach. And
Mhm.
it's not the learning that really matters, but it
Mhm.
is the action that comes with it. Because any learning that you have, but if you don't do the action, then everything is nothing. So,
Mhm.
in other words, this is really a very delicate, like Joyce said, that those people that works in a healthcare services,
Mhm.
they should know better. But unfortunately, a majority of them, in fact, it's probably 40% are still not vaccinated
Not
because of
vaccinated.
their own belief, they're unvaccinated, because of their belief and the way they accept the fact of being presented. Again, I think it's a better, if the government will do a better guidelines on how to actually deploy this plan.
Mhm.
And then, like I said, we created a guideline, we create a plan. We have to make
Mhm.
sure we do action on it. Because again, I just like said, without the action, any good plan, any good guidelines is nothing.
That's
So,
right.
and I know that the government's already, even some states already mandated that every week a
That's right.
health worker must do a weekly test.
Yeah.
And,
My question for Joyce is, in the early days, Joyce, were you worried that Arman might be bringing home the virus um, endangering the health of your family? Did you have that fear? I've talked to a lot of nurses who had that fear.
Yeah, that was definitely our biggest concern.
Mm.
So he's in the post anesthesia care unit, right? And New York and Jersey City was really where the peak of the pandemic started.
Mm-hmm.
So
Mm-hmm.
his unit ended up being converted to a COVID unit because
Oh.
of the huge shortage that they were experiencing, and with the many patients that they were having. So we were definitely worried whenever he came home. He had to like really strip down in the garage. It's like not bringing any of those germs
That
inside
is
the
another
house,
common story, yeah.
and like spraying down, his shoes, his clothes, everything. He goes straight to the shower. um
Mm.
and we really like kept a distance from each other for the first few weeks.
Mm.
He doubled up on his vitamin C, zinc, everything, because that's the only thing that we could do. Like, that was like the extra precaution that we could take to make sure that our children, we have 5 kids, and then the youngest at that time was only 7, turning 8. It was really scary. And then seeing what his hospital was going through, that they actually ended up having to have like a trailer or two being used as morgues because they were running out of space.
Oh, okay.
Yeah.
And he probably slept in another part of the house.
Yeah. Yeah, he was on timeout. He was in the doghouse.
Okay.
Yeah, I feel
I
like I
think you never
people have
mentioned.
forgotten. People have really forgot. I think almost forgotten how bad it
Yeah.
really was back
Yeah,
in
yeah.
April of 2020.
Mm-hmm.
It almost seems like that some people are in denial that it actually happened, and we're not going to ever go back to that place. But why are we going to put ourselves in that position to have all these beds in ICU taken when it should be to providing regular care for those who really need it? So it's just mind-boggling how we're in this situation where we have a preventative measure like Joyce mentioned, and the education like Judith shared, um,
Mm-hmm.
to prevent this to spread, but we're just going backwards at this
Yeah.
point.
Is it my I think my other question is that, like, we focus on vaccination, which is good, but then we should also focus on what do you do when you feel symptoms. There are people who are vaccinated and then they get symptoms and then they think they can't get COVID. I think the important thing that as healthcare professionals or family members who have healthcare was like, you have to have your test at home, and any symptoms that you have that you feel right away, you should get tested. And then because then it's right there. And then once you test positive, you should tell people, and then you should get the monoclonal antibodies, because then the likelihood of surviving COVID is a lot better than when it's known towards the end. And of course, you have to stay healthy, take your vitamins, and all that stuff. I think as a whole, we should talk more about that too. I mean, great, get vaccinated if you can. If you can't get vaccinated for whatever reason, make sure you test every day so you don't get other people sick. And if you get sick, make sure you get the treatment right away. Don't be on denial in it. Don't be like,
Yeah.
don't wait. And then you tell other people so they get quarantined. So yeah, I'm very emotional about this.
And
Any reaction, Judith?
Yeah, I agree with that, and all of those beautiful information. That's good, and
Mhm.
I believe, and I'm stand strictly about this, that everybody must be responsible. It is the
Yeah.
responsibility for each and every one of us to make it these things clear. Because, for example, let's say we don't have this pandemic right now.
Mm-hmm.
You don't feel well today. So what are you going to do? Are you going to go to work and do some services, or are
Mm-hmm.
you really trying to spread whatever you have in yourself? So
That's
I mean,
true.
if you think that you're sick, stay at home and feel better and do something about it. And like we all been told, it is not
Mm-hmm.
that you know things, but you have to do something with it.
Do
If
you,
we,
do you feel that do you feel that the issue of vaccination is being politicized unnecessarily, Joyce?
Um, I I think partly because of the peak of this pandemic was also a transition in leadership, at least within here in the United States.
Mhm.
I manage about 30 countries for for the clinical studies that I oversee, and COVID-19 has been on my tracker. I see the updates every day from the different
Mhm.
countries. So I already saw that, the lockdowns that are happening across the world because of the fact that people are still resistant in getting the vaccine, and they've let their guard down. That's what it
Mhm.
is.
Yeah.
People got tired, and they feel like it is getting politicized, and that it's their body, it's their right, which I totally agree.
Mhm.
But if the science is showing that this vaccine works, and you're seeing the data that majority of the people that are getting COVID now and are in the hospitals are unvaccinated, I
Mhm.
just wish they would follow that
Mhm.
information and then take the time to educate themselves better
Mhm.
before, really just being adamant about not wanting to get the vaccine because they feel like it's the government forcing it.
Yeah.
Um, so
Judith, would you like to add to that?
Um, well, just
Vaccination being politicized unnecessarily.
no. Actually, it's we go back to the education and be a responsible person. Because like what's happening today is like we continue to criticize other people, and I think it's a human nature the way it is. But the thing is, what are you gonna do if you have a problem? What are you gonna do? Are you going to think about the problem, or are you going to think about the solution? So
Mhm.
let's face it, that's the way it is. The problem comes and goes. But people who handle the problem in the right way by
Mhm.
simply taking action on it, they're all successful in resolving it. But the
Mhm.
people who doesn't really think about the problem but continue to complain, continue to think about the problem, can't do anything much but to fail.
Yeah. Okay.
So, I
What
guess it's really a matter of being a responsible individual.
Mhm.
what
Very
do your
good.
children feel about the whole pandemic being children of frontliners? I mean, some of you have young children, and then some of you have like adults already. Um, what are their fears, or what are their concerns? We'll start with Judith.
Okay, for my kids, I have actually two kids, Jude and Michelle. Are already on their
Mhm.
uh, late 20s,
Nice. Yeah.
and they're young. And of course, the younger you are, the better opportunities that you're going to fight the virus. But again, it's not that reason. I We always tell them that we have to be careful all the time.
Mhm.
We have to follow the guidelines that the expert is implementing because
Mhm.
they were the expert, so they know the best for everybody. All we have to do is to follow the guidelines. The reason why we have the guidelines is to follow it and be safe all the time. And they actually follow that one, and including their friends. So it's not only
You do
because
not you do not face any resistance from your kids.
for us, I would like to take this opportunity to thank Joyce because during the early stage of this COVID, Menchu is the first one that has this because of her condition. She is really highly immunocompromised. But of course, my children and myself are not. So
Mm.
thank you, Joyce, for helping us to be
welcome.
right away because she's thinking of my wife that is not really safe.
Oh my God, a lot of people love Menchu, you know.
So I appreciate that
Our community loves Menchu.
we're all vaccinated. We already got our third booster, and
Mhm.
we really believe that this will help us. It is not only, I do believe, and I believe people should uh, really think that when you are vaccinated, you are not just protecting yourself, you're protecting others.
Yeah.
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 What about
So,
you, Joyce?
Joyce, would you like to respond to Jen's question?
Yeah, so you guys know we have five children aging from 9 to 25. So see, being that they saw what this pandemic did to their dad, to the community, they were very respective of the fact of what we do as as for our careers, being a nurse, being in the research industry. They knew and saw how hectic our lives became when this pandemic started. So they always respected that, the information that we shared with them. And honestly, they couldn't wait to get vaccinated. Like Kuya Judith said, in the beginning of the pandemic, it was so hard to get vaccines once it came out. So
That's
we
right.
actually helped thousands of people getting vaccine appointments. And it was our children that helped a lot. They would stay up until midnight trying to wait for those vaccine appointments to open up. And we would
Oh,
probably book about 50 to 100 people per day. We had like 5 laptops open. And so when it was finally their turn to get their vaccines, they were really excited. And I follow all the clinical studies to support whether or not these vaccines are safe for,
yeah.
from our age range to the teens, and then now down to to the youth.
I
um
remember Jen was also doing that for her own family. Remember, Jen?
I
You were
know it
telling
was
us about
it was
trying
like
to get appointments for
it
this
was
and that.
frustrating. It was
Yeah,
frustrating back then. So
yeah.
I
But
mean,
we're over that now.
yeah.
well, we might not be over it because now it's the booster, right? Like everybody's
Yeah,
rushing
yeah,
to get the
yeah.
booster now.
Yes.
That's right.
So,
Yeah.
Judith, how, or in your own little way, how have you been able to educate other people about getting vaccinated? Now that we're, in this circle that we have now, we all have vaccinated, but we also have people, family and friends who are not vaccinated. How have you been able to educate them?
Yeah, as you know that I'm also come from healthcare. I'm a med tech, and I have an
Mhm.
experience in doing stuff like that viruses, bacteria, fungus. So I use that knowledge to tell them exactly what we have, and then of course I refer them back to. You can go to Google it and find out more information. And the best way to do it is go back to the what was the term, the CDC staff. CDC
Hmm, yeah,
information about that, and that goes for all my friends and family friends, and even in the office.
so you talk to everybody, not just the Filipino community.
Yes, not only the Filipino communities. Where I talk in the office, some of them are not really vaccinated. But again, it's just it's a choice for them. And I go back to the initial thing that I keep on saying that the education is a very powerful tool. But again, we don't stop there. We have to do some action into it. We always follow an action to every guidelines that anybody creates, like the guidelines CDC implemented. We just don't read it. We have to do action on it.
That's right. Joyce, Arman, during the height of the COVID, did he experience some kind of a burnout or was he stressed out?
Oh
How did
yeah,
you help him with that condition?
definitely burnout.
Burnout, yeah.
He had, like, out of the full staff that they had working,
Mhm.
I think there's about 12 of them. He was a part of the last three standing. And I say that because
Wow.
everybody else either took leave of absence, decided to retire. And so, yeah, like they couldn't handle it. They couldn't deal with it. And I felt so
Oh
bad
my
for
God.
him. And I think the hardest part for them was like seeing people pass, not being able to say goodbye to their loved ones.
That's
And
right.
and that's what I still keep in my mind up
Mhm.
till now is, even though we're vaccinated, we've been having parties. But if you see my invitations always say, please only if vaccinated, because I still have young children that I want to protect.
Oh,
Trying
that's
to make
nice.
sure that
Okay.
everybody still stays responsible, that yes, we're slowly creeping back to normal, but we're definitely not, going to become irresponsible and have unvaccinated people mixing with the vaccinated ones.
So are we unfriending people who are not vaccinated? I don't.
Well,
No,
indeed, no.
no, we're not unfriending people. We're just being respectful of each other's, choice and opinion.
We are
Um,
not unfriending. We're just disinviting them for the
yeah,
whole.
like it's just being very front and honest, right? That I want to protect my family, and as much as I'd love to see you, but if you're not vaccinated, you know, please respect our choice, like we're
Do
respecting your
they?
choice.
How do they react to your protocol
Um,
mandate?
I haven't received any hate letters yet, so
What about you, Judith? Are you having parties for the holidays, and are you issuing these kinds of uh,
Yeah,
advisory?
we do the same thing that Joyce mentioned, but uh, Menchu and we have an agreement because of the nature of her. I told her that, well, we have to protect the opportunity and the blessing that God gave us for you.
Yeah,
So we all sacrifice those partying and everything.
yeah.
Even going to church, it's we go virtual unless otherwise.
Oh,
Michelle,
yeah,
yeah,
yeah.
Michelle
Us
actually.
too. Yeah,
Right? So if Michelle told us that, okay, ma'am, there will be less people this coming this time. So we go there and we always sit far away from anybody.
everybody.
yeah.
That's right. That's what COVID has done to us.
Yeah, the
Um,
good the chart
what
is
about
yeah,
what about this threat of patients that are attacking the nurses? Have you seen any of that? Is that something that Arman has experienced or has witnessed?
They've had their share because of the fact that, they have protocols to follow,
Mm-hmm.
and people have a hard time of understanding that
Yeah,
while the nurses cater to your care and well-being, they also have to follow the rules set forth within the hospitals. And sometimes those, like, you have to wear your mask, or you have to,
mm-hmm.
you can't have visitors, or whatever it is. And they've had
That's
some
right.
hostile patients here and there where, people have threatened them and said, this is ridiculous. I'm not going to follow
Yeah,
this.
yeah, that's right. I Anyway, thanks so much, Joyce and Judith. Thanks for coming over to the show and sharing your stories and some of your anxieties with Makilala TV. Thanks also to my co-hosts, Jen and Rochelle. You have some really great questions. We have heard so much about how families of nurses restructure their lives because of the virus, some of them living apart until it was safe to get back, some of them living in another state. Sadly, the pandemic is not going anywhere, and we are just thankful that nurses, doctors, healthcare professionals remain at the front line, making sure that everyone is safe. From all of us at Makilala, thank you, and to all our viewers, keep watching.